and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you for joining us. Today we welcome Caitlin Pico of the Quincy Health Department to talk about the seasonal flu. So Caitlin, welcome to this program, a brand new program here at Quincy Access Television.
Yes, thank you. I'm happy to be here.
We've spoken in the past, we've done programs in the past, so it's certainly, you're no stranger to QATV, but nice to have you back.
Yes, it's good to be back. It's been a little while, so very nice to be back here.
And we should start with one of those topics that is addressed every year, and that's the seasonal flu. Certainly on the minds of many people, as is the COVID-19 pandemic as well. So I do want to, as we go through what the flu is, there will be differences from COVID-19, the coronavirus, and the flu. But we should mention that people can die from the flu as they have from COVID-19.
Yeah, so the flu can be severe, especially if people are at higher risk, which we will go through a little bit later. But people should make sure they're getting vaccinated for both COVID and the flu, because even though your symptoms could be mild, you wouldn't want to pass it on to somebody else who could get really sick and unfortunately sometimes can cause death.
Absolutely. So let's start looking at the outline. So you at home know what to expect. We will start by talking about what the flu is. Then we will talk about symptoms, how the flu spreads, complications, individuals at high risk, prevention, this flu season specifically, and testing vaccine facilities. So let's start. It's always good to start with a definition. So what is the flu, even though it might be obvious to some folks?
Yeah, so I thought we could do a little recap because it's been a while, of course. So the flu is a contagious respiratory illness that is caused by the influenza virus, and it infects the nose, throat, and lungs of an individual. There are two main strains, which is type A and type B. And as I before mentioned, it can cause mild to severe illness in individuals. So you really want to make sure you're taking your precautions, especially as we're entering this flu season.
As we get into the symptoms, folks will recognize that these symptoms aren't only associated with the flu.
Yes. So as we go through these symptoms, people may notice they're almost exactly the same as COVID-19. There are missing a few that COVID would have, but for flu symptoms, these generally come on suddenly for an individual. The incubation period is relatively short. You can start experiencing symptoms 1 to 2 days following your exposure to the flu. So these symptoms may include fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and then some individuals might have GI symptoms, including vomiting and diarrhea. A lot of times we'll see this in young children when they get the flu. It's more common. And it's important to know, since these are so similar to the flu, especially this season, if you are experiencing these symptoms, I do recommend calling your doctor or going to a testing site to test for both the flu and COVID, just to rule them out and make sure you're not getting anybody else sick around you.
Good point. When you mentioned fever, I was just curious, what is the best way to take someone's temperature?
So for the temperature, it depends. Obviously, if they're a young child, the rectal thermometer would be best. Typically, I know they do have like the forehead ones as well. I've always done the one under the tongue, and you hold it there until it beeps, and then you can get an accurate reading. You just want to make sure you're holding it under your tongue for the right amount of time.
So that seems to be the tried and true method. Yeah, I'm used to that too. I've done that for years. Let's look at how the flu spreads. The flu is very contagious, we should mention.
Yeah, so it is very contagious, and it is a droplet transmission. So it might sound a little gross when we say this, but basically what happens, influenza is in the saliva of an infectious individual. So when they are coughing, sneezing, or talking, teeny droplets can come out of the individual's mouth and land in the mouth or nostrils of somebody around them and then get that individual sick. Because the teeny droplets, the virus then attacks their cells and multiplies to make that individual sick as well.
And I suppose the one of the things that might reduce the spread now is that folks are used to wearing masks because of
Yes.
COVID-19. So that is providing a layer of protection against the flu as well.
Yes, and then it's also important to know that the flu virus is known to live on surfaces for up to 48 hours. So you want to make sure you're also, especially if somebody is sick in your home, you make sure you're wiping down those frequently touched surfaces such as faucets or doorknobs. Because if somebody were to touch a surface where the virus is live and then touch their eyes, nose, or mouth without washing their hands, they can get infected that way as well. But it is interesting to know last year's flu season was very low because of all the mitigation strategies used for COVID, such as the mask, social distancing, and people weren't as frequently out socializing.
And getting back to how to kind of protect yourself and not spread the flu if you do have it, getting back to cleaners, is bleach or cleaners with bleach important, or is bleach a good ingredient?
Yeah, so there is a mixture you can make. I don't know the exact mixture off the top of my head, so you may want to look it up online. But it would be a bleach and water mixture. I believe it's 1/4 bleach, the rest water. Shake that up and you can spray it on your surfaces, and that would be able to kill these viruses. And you, if you're at like a grocery store or buying cleaning supplies, a lot of times the supplies will have on the label whether it can kill viruses or not.
And what, I know we're going to get to hand washing in just a moment, but what do you, or how do you feel about hand sanitizers? Obviously, if you don't have access to running water and soap in any given situation, hand sanitizers can help.
Yeah, so hand sanitizers are great when you're on the go and you don't have an available sink around you. I find a lot of times it dries out my skin, so I like to use soap and water because that's one downside to the alcohol in the hand sanitizers. But I would say use soap and water when you have a chance, but if you're on the go, use hand sanitizer.
And I know most of us, when we wash our hands with soap and water, we don't wash our hands long enough. So what is the, and I know people are going to, I won't have you sing the song, but what is the general rule to washing with soap and water?
So a lot of times, we actually did this with a kindergarten class in the health department. Teach them to sing happy birthday as they wash their hands. And once you get through the whole song, you'll know that you got a good amount. You want to make sure you get it in between your fingers and under your nails as well.
Is it 2 courses of happy birthday?
Yes.
Yeah, okay.
Yes,
So you go through the song
correction.
twice. Simple, right? A simple thing to remember, but it does make quite a bit of difference. And are we talking warm, soapy water or cold water? Is there a difference?
So I don't know if there's a total difference. I would probably go on the warmer side, and then, but I'm
during
not
the
too
winter,
sure.
most
During the
people
winter,
would
yes.
prefer warm anyway.
Yes. But any running water would be sufficient.
And again, if you don't have access to water at any particular time, just grab a hand sanitizer and use that.
Yeah.
And just, again, as you had mentioned, just be aware of where you're touching,
Yeah.
what you've touched maybe, and then what you're touching on your person, like you said, your nose, your eyes.
Yes, because a lot of people, especially when they're out and about, like a lot of people, I'm guilty of it myself. I touch my face a lot. So with these viruses, that's one thing you do not want to do. If you wash your hands, of course, you can touch your face when you're at home. But if you're out and about and you don't know what you're touching, especially if you're at stores, you don't know who was there before you. So one big rule of thumb is if you're out of the house and you can't wash your hands, don't touch your face.
You know what I've noticed, if folks are going to the store, often they'll clean the shopping cart. Maybe they'll use some kind of a towelette.
Yes, yeah.
That's also helpful.
That is helpful. I always would I like to do that myself. A lot of stores also are cleaning carts themselves, which is nice. But if you don't know if it's cleaned or not, it doesn't hurt to wipe it down. I'd still say go home and wash your hands, of course.
Of course.
Yeah.
Let's look now at complications.
Okay, so a lot of people who get the flu will recover in a couple days. A lot of people won't need any treatments. Mostly it's just get rest, sufficient hydration, and then once your symptoms go away and you have no fever, you can resume normal activities.
And I just want to stop you there for 1 second because you said stay hydrated. So a lot of times when you're sick, people will say, oh, I don't want to drink, I really don't want to drink, but that's really important.
It is very important, and a lot of times, especially in a complication in young children with the flu, is dehydration, because it's hard to get them to drink the fluids. But you want to keep in mind that without the hydration, you're going to have extra symptoms. You're going to have a worse headache. You're going to have more fatigue. So you want to make sure you're really staying hydrated to keep your body up and healthy during your infectious period.
Good point, good point. So I stopped you from where you were at just to talk about staying hydrated, but I'll let you continue.
Yeah, so as I said, so most people it will be very mild, and then they normally recover in a couple days. Sometimes it can take up to 2 weeks. But the one thing that would kind of keep you on there is if you're still having fevers, you wouldn't want to be going around other individuals. But for some people, and I will get into in the next section, high-risk individuals, they can cause more moderate to severe infections. So moderate, you could see sinus infections or an ear infection, which you see a lot with little kids when they get diagnosed with the flu. But then severe complications can lead to pneumonia, myocarditis, which is inflammation of the heart, encephalitis, which is inflammation of the brain, mitosis, which is inflammation of your muscle tissues. People can experience multi-organ failure, especially your respiratory and your kidneys. And then some people can even get sepsis from that. And so sepsis is basically when you have the flu virus in your respiratory system. It's your body has an extreme inflammatory response. So your body's trying to fight it off, and that infection can make you go into sepsis, which is life-threatening. So if you're having severe symptoms of the flu, definitely check in with your doctor and make sure that you get this all figured out before you get to sepsis.
So, well, you said that 2 weeks, you could have the flu for 2 weeks.
Yeah.
So I guess my question is, when is it the right time to maybe put a call into your doctor to say,
Yeah.
gee, I don't know, should I be feeling better at this point?
Yeah, so a lot of times, when people get diagnosed with the flu, of course, that requires testing. So if you're experiencing symptoms, even minor fever, call your doctor. They would test you for both COVID and the flu at this point. And they'll be able to give you guidelines to monitor. Like if you're having severe high fevers every day, your doctor may want to have you come into the hospital to be evaluated. So it's really just keeping a close connection with your doctor. And they're overwhelmed as also right now with COVID and everything going on. So if you can't get in touch, you can always call the local Board of Health and we can help assess the situation.
And we should mention, I don't know if we're going to get into this, and maybe I should look at my outline first, but You can self-medicate to the degree or to the usefulness that it will lessen the symptoms.
Yeah, so a lot of times, like a lot with the flu is just treating your symptoms. So it's that hydration. A lot of people will take like Dayquil or NyQuil to help with the congestion. A lot of times Tylenol and Motrin will help break the fever. So as long as your symptoms aren't severe and you can manage it at home, your doctor would give you that advice. As a nurse, I of course cannot advise medications, but as long as your doctor approves you to take that, it's just managing it at home. But if you think you're having severe reactions or you're really not feeling good, definitely call your doctor. It doesn't hurt to get a healthcare opinion.
And one other thing, and I think I know the answer to this, but I'll test it out on you. When you're resting, when your body's at rest, it's also basically recovering itself.
Yes.
So
yes.
Get plenty of rest if you have the flu.
Plenty of rest, yes. And that's why I know we keep saying hydration. I'm very big on hydration. But you want to make sure your body has adequate fluids to recover and get you on the right track.
Well, I don't know what percentage of our body is water, but it's a high percentage.
Yes.
So the hydration portion is, again, very important, and you can see why. Individuals at high risk.
So individuals at high risk, so this includes individuals who are 65 years old and older. So there is a flu vaccine that is a higher dose for these individuals. And the reason they're at risk is they say, according to the CDC, it's because your body's immune defense can weaken with age, which is very natural, of course. But one thing that I saw in my research for this is they say individuals 65 and older, they shouldn't get the flu vaccine too early, because if they get it in August, by the end of flu season, which could last through May, their protection can wear off. So you want to make sure that you get that vaccine between October and November. They say by the end of October.
We should just mention, while you're mentioning vaccines, and maybe make highlight the difference between the COVID vaccine and the flu vaccine, because someone might say, well, I'm not going to get the flu vaccine because I got the COVID vaccine, so I think I have protection.
So they are two complete different viruses. So COVID would be the novel coronavirus that caused the infection, whereas with the flu, it's the influenza. So the vaccines, the COVID vaccine is only for COVID, whereas flu is only for flu. So it is important to get both of those.
Looking further, asthma.
Yeah, so these are individuals with chronic medical conditions. So that would include asthma, diabetes, heart disease, and kidney disease. And a lot of times with these, so asthma is, even if you have mild asthma, an individual who has that condition can have irritated or sensitive airways already. So the virus can really exacerbate symptoms and cause asthma attacks. So you can get really sick with the flu. And then for diabetes, heart disease, and chronic kidney disease, it's more because these conditions can weaken your immune system, so your body doesn't have the ability to fight off the virus, as well as somebody who may have no underlying health conditions.
Okay. Pregnant individuals.
So pregnant individuals, so they say that this is because of the changes to the mother's immune system, heart, and lungs during pregnancy. So she could be very susceptible for complications throughout the pregnancy up to 2 weeks postpartum from the flu. So they do say that the flu vaccine is safe for a pregnant woman to get, and that depends. Of course, check in with your doctor before getting any vaccine. But if you get it in the 3rd trimester, I believe it can give some immunity to your baby for their first couple months of life.
Let's talk about children, not quite that young. Well, actually, children younger than 5. So yes,
Children,
I guess
yes. So children younger than 5, so they can have all of, we kind of went over them, but like a lot of times they can get pneumonia, dehydration, worsened medical problems, including if they had asthma or heart disease. And then they, a lot of times, will see the sinus and ear infections as well. But you want to keep in mind, like, dehydration is preventable. Pneumonia, you just want to make sure if your child has flu and they have a severe cough and it's not improving, always check in with the doctor because it could have developed into pneumonia.
Absolutely. What about allergies, people that are allergic as far as concern getting the flu shot?
So allergies, so they the flu vaccine is considered very safe. They have, you would want to make sure you disclose any different allergies you may have, but there are 3 different vaccine ways to produce that vaccine. So I know a lot of times it was like an egg allergy, but now they have 2 different ways to produce them that an individual with an egg allergy could still get the flu vaccine. So if you have severe allergies or if you've had a reaction to a flu vaccine in the past, just check in with your healthcare provider so they can make sure it's safe for you.
Very good. And I know we touched upon this earlier. Probably it was my fault for bringing it up too soon, but prevention.
Prevention. So that's always my favorite part of any of these because that's the most important. So the first and most important one, again, is vaccination. Especially if you're at higher risk, you want to make sure you're getting that vaccine because even if you do get exposed to the flu, hopefully the symptoms will be milder than if you were not vaccinated at all.
So you could get the flu even though you got the flu shot, but it would be mild.
Yes,
Okay.
yes. And one thing that I saw all online while I did my research is a lot of people want to know, can you get the flu from the vaccine?
Very good question.
Which is not true.
Not true.
Because it is not a live virus.
Okay.
So it could happen that you may get your flu vaccine, you could be exposed in the same time period, because the flu vaccine doesn't give you immunity for up to 2 weeks after. Your body has to build the antibody.
There's a person that I know that said that he didn't get the flu till he got the flu shot, but clearly that was not true, that maybe he had that already in his
Yes.
body, or maybe, again, you said it's a 2-week incubation, or
So
a 2-week effectiveness for the shot to be totally
Yes,
effective?
2
Okay.
weeks for your body to build that immunity.
Very good.
Yes.
Okay.
Yeah.
Avoid close contact.
Yeah, so you would want to avoid close contact with sick individuals. If you yourself are sick, stay home, and then contact your healthcare provider. I can't stress that enough. You want to make sure you're covering your nose and your mouth when you're sneezing or coughing. It's always, I know everybody has learned this throughout their life, you always want to do it into your sleeve, because if you're coughing into your hands and then touching something, it's just going to spread it to more people.
Absolutely.
Or even better, if you have a tissue, maybe keep a tissue around. Hand washing is huge. Make sure you're washing your hands anytime you're coming in the house or going out in public and you don't know what you're touching.
And how long do you, I don't know that this is a question that anyone can really answer, but how long would a flu germ stay on a surface? Does it depend?
So according to the CDC, it can be up to 48 hours.
Okay.
Yeah, and it's hard to determine, but it's mostly the droplet transmission is how you would get sick. It's less likely you're going to get it from a surface, but that's why I just stress cleaning those high-touch surfaces, washing your hands, and if you can't wash your hands and you have no hand sanitizer, make sure you're not touching your mouth, nose, or eyes.
Practice good health habits.
Yeah, so that would be more just making sure you're getting plenty of rest, making sure you're hydrated, making sure you're eating nutritious meals, because the healthier you are and your body is overall, the more likely you can overcome the illness and feel better.
Very good. At the I guess we have a couple minutes left, so I do want to ask you if there isn't anything we have touched upon. Testing, you mentioned testing and vaccine facilities. Mentioned this flu season. Have I mentioned or forgotten to mention anything?
So I believe that is also at this time it's still low. A couple little updates where all flu vaccines are going to be quadrivalent. I can't pronounce that word. I apologize.
It's probably better in your house than it is mine, because I have.
I'm awful with pronunciation. I'll have to
Well,
say.
these are tough. Any medical term seems to be very difficult to pronounce, but go ahead.
What that means is it protects against 4 different strains, and each year, all year, the CDC and then the FDA, they're all monitoring for all these variants that may be out, and that's how they kind of predict what will be circulating this flu season. So they did update the doses this year, and I do have a slide that you can put up for that. And those are like what they predict will be circulating this year, so that's what the flu vaccine will protect you from.
Okay.
Yeah.
And if anyone has any questions, you had mentioned obviously to call your healthcare provider. The health department, the local health department in any community would
Yes.
also take calls, I would imagine,
Yes.
or inquiries through email.
Yes, or through email, and all of our information is on the Quincy MA website. I quickly just want to say there are testing facilities. If Manit, Convenient MD, Beth Israel Lahey, CVS, and Walgreens. So those are all facilities in Quincy that you could schedule for testing or if you needed a vaccine.
And a lot of those are also available outside of the cities, so
Yes.
folks that live in neighboring towns
Yes.
could also use those sites as well.
Yes.
Very good. Well, I want to thank you, welcome you back, first of
Yes.
all, for another program. A lot of information out here for folks, and have a great flu season. Stay healthy. Don't get the
Yes,
flu.
you
And
too.
we hope that folks at home stay healthy as well.
Yes, yes.
Thanks
Thank
again.
you.
And thank you at home for watching. Please stay healthy and continue to watch your local access TV station for more programming just like this.